Following popular demand, I decided to once again take a critical look into prostate issues. As a man, do you know the status of your prostate and how to keep it healthy? What does it mean to have an enlarged prostate? As a woman, have you any idea how you can support the man or men in your life in maintaining a healthy prostate? What are the symptoms of an ailing prostate and what treatment options are available for such ailments? These are some of the questions you will be enlightened about on today's show. Welcome to Talking Health, your go-to program on health matters. I am Buni Idowu. Before I bring on the expert to educate us, let us see this brief report on prostate health.
Prostate health is a critical aspect of men's overall well-being, yet it often remains a silent concern due to societal taboos and misconceptions. This report aims to provide an overview of the prostate gland, common prostate issues, risk factors, and strategies for maintaining prostate health. The prostate gland is a walnut-sized organ located below the bladder and in front of the rectum in men. Its primary function is to produce seminal fluid that nourishes and transports sperm during ejaculation. The prostate gland surrounds the urethra, the tube that carries urine and semen out of the body. But sometimes, this gland gets enlarged or inflamed. Experts have segmented the stages of prostate issues as benign prostatic hyperplasia or BPH. This is a non-cancerous enlargement stage of the prostate gland, which commonly occurs with age. Symptoms include frequent urination, difficulty starting or maintaining urination, weak urine stream, and incomplete emptying of the bladder. The second stage is prostatitis, which refers to inflammation or infection of the prostate gland, often causing pain or discomfort in the pelvic area, difficulty urinating, and flu-like symptoms such as fever and chills. And then, the big one, which is the prostate cancer. Reports say that prostate cancer is the most common cancer among men worldwide. It occurs when abnormal cells in the prostate gland multiply uncontrollably. Early-stage prostate cancer may not cause symptoms, but advanced stages can lead to symptoms such as difficulty urinating, blood in the urine or semen, erectile dysfunction, and bone pain. According to the World Health Organization, WHO, prostate cancer is one of the most common cancers and accounted for 1.41 million out of 10 million cancer deaths recorded in 2020. Experts say there are many risk factors for prostate cancer, which increase with age, particularly with men over 50. And these include family history, race, as it is believed that African American men have a higher risk of developing prostate cancer and are more susceptible to the aggressive forms of the disease, which require radiation, surgery, hormone therapy, chemotherapy, or other treatments. Lifestyle factors such as poor diet, obesity, sedentary lifestyle, and smoking have also been identified as capable of increasing the risk of prostate cancer. So, to maintain a healthy prostate, some strategies such as regular screening, healthy lifestyle, and limiting alcohol and tobacco consumption have been identified. Prostate health is a vital aspect of men's overall health and quality of life. By understanding common prostate issues, recognizing risk factors for prostate cancer, and adopting proactive measures for prostate health maintenance, men can take control of their well-being and reduce the burden of prostate-related diseases.
I am the life, the pure many wish they were. I define what premium means to most and still defining. Every royalty asks of me. Dignitaries drink me with no question. I am not loud, so you won't find me in traffic. Seated at momentous ceremonies, luxurious events, and premium parties only, I am exclusive. With an unmissable presence in over 40 countries, I am global. I am the life of every occasion and gathering. I am Nestle Pure Life. Without any introduction, I am the life of the party.
Welcome back and thanks for staying tuned. To speak to the issue at hand, that is prostate health, and all there are to know, is Dr. Rashida Basi, who is the Chief Medical Director at Heritage Men's Clinic here in Lagos. This high-flying medical practitioner completed his graduate medical education at Yale University School of Medicine in internal medicine and a certificate program in congestive heart failure. Since his completion of training, Dr. Abasi has held a faculty position as a clinical instructor of medicine at the University of Maryland School of Medicine, Baltimore. He has authored numerous bench research papers in physiology and pharmacology and has served as subject matter expert to the Nigerian government in the areas of healthcare infrastructure development, capacity building, needs assessment, policy and strategy towards improved access to healthcare. Also, he was a subject matter expert towards the establishment of the Nigerian National Primary Healthcare Development Agency. On the international level, Dr. Abasi recently completed a major audit of the CDC Atlanta PEPFAR program in Nigeria. He is the CMO and founder of Sisimi Medical Foundation Incorporated. Thanks for joining me in the studio, Dr. Abasi. How have you been?
I'm okay. The pleasure is all mine. It's great to be here.
Very well.
Thank you.
Let's go right into the subject matter.
Excellent.
As a medical practitioner who has been in the industry for over almost 2 decades,
Yes, yes.
how would you define prostate cancer to us?
Excellent, excellent. And thank you for the opportunity to be here. So cancer medically means when your body or my body cells outgrow their normal size. Normally, we grow cells every day. We shed our skin, we shed our hair. So in this case of the prostate gland, which, for clarity, only men have prostate. Women do not have prostate. And this prostate gland is just the size of a small peanut at the base of the bladder. We know how it's supposed to grow every day. We know how it's supposed to grow yearly. So when it loses control of that growth, we say it becomes cancerous. So cancer is uncontrollable growth of any cell in the body. So in this case, we're talking about the prostate.
Okay. I know that nobody just wakes up in the morning and say, I have prostate cancer. No man just wakes up to say, what are the stages that leads to this and how can those stages be detected?
Fantastic question. As a matter of fact, if there is anything positive about prostate cancer, is that it's one of the slowest growing cancers men will ever have.
How do you mean?
So for your prostate, or for a man's prostate to grow from even 1 to 1.1, it takes an average of about 10 years.
From 1 to
1.1, yes. It takes an average of about 10 years.
How grave is that 0.1?
Good. So now we're talking in terms of numbers, because medicine nowadays is all about numbers. Okay. So let's say, for example, Nigeria, we're the most populous black nation. The rate at which we're seeing prostate enlargement that leads to prostate cancer is at the rate of 33%. 1 out of every 3 men listening to us now is going to be afflicted with one form of prostate problem or the other. It's not all gloomy. The good news about it is most of the problem with prostate are not cancerous. Only less than 10% of the problem with prostate are cancer.
At least that's good news.
That's good news.
Okay.
And so everything about medicine and cancer is the earliest we can pick it up, the better the outcome. The better the treatment options we have, and the better the patient will outlive the cancer itself.
Okay, so if somebody is constantly having migraine, anybody, almost anybody can say, oh, go and check for this, go and check for that. Yes. What are those symptoms any man should look out for to say, oh, I think you're having prostate issues. What are those symptoms?
Excellent. And the good news about men's health advocacy is that we want men to be aware of these things before it actually starts showing signs. So as I said, only men have the prostate. The prostate has a way to talk to every man. It releases one chemical that only that chemical comes from the prostate. It's called the PSA, prostate specific antigen. This particular protein does not come from any part of the body, not the brain, not the kidney, not the liver, only the prostate.
Wow.
And for every man now, we know what the number should be based on age. So now to the larger part of your question, what are the things that we should be aware of before it becomes big for us to handle? So for any black man, because I emphasize black men, because prostate cancer is mostly affecting races like black, races like Spanish. We still don't have an answer for that. We know it affects all men, but majorly are people of color. We're talking blacks, we're talking people of Sub-Saharan Desert, we're talking African Americans, we're talking Spanish people.
Okay.
And the rate at which we're seeing it among blacks is even outstanding. It's more than white. Wow. The two forms of cancer that affect men majorly are skin cancer, affects more white men than black, and then prostate cancer. So prostate cancer is mostly endemic to we or black people. There are some research out there that says it has connection to melanin, the skin pigmentation and all that, but that's still out there. Okay. And so for any man listening to us, if you're approaching the age of 40, you should be checking your prostate. What are the things to do? When you go for your regular routine medical checkup, ask your doctor, enlighten them that, hey, I need to check my prostate. That is for any man that does not have any family history. Family history, I mean, no uncle, no dad, no brother has had prostate problem. However, if you come from the family that you have had some issues with prostate problem, you should be checked 10 years before the diagnosis of that family member.
I know, it's 10 years before then.
Let me say that again. So if my father was diagnosed at 50 with prostate problem, either prostate enlargement or prostate cancer, I, as the son of that man, should be checked at the age of 40.
What if the father never had it?
That is the problem we're facing. Not only that, even what if I was adopted? Or what if I never knew what happened to my dad? And that is why the latest literature now says any man that you are up to sexual age, we're talking 18 and above, before you even see symptoms, encourage your provider to check your prostate. Check your PSA, prostate specific antigen. It only comes from the prostate. That's the only way the prostate talks to the doctors, that, hey, something is wrong with me or I'm okay.
Wow. How can this be diagnosed, really?
Yes.
And, what are the common screening methods?
Excellent. So when a patient comes into my office as a young man and as a physician that is in the active of practicing, I ask common questions. How many times do you wake up at night in the middle of the night to wake up to pee? Any man should be able to sleep for 6 to 8 hours without waking up to pee, because your bladder as a man can expand for 8 hours and keep the urine to allow you to sleep from 10 p.m. to 6 a.m. without waking you up to pee.
Some people actually go to bed drinking lots of water. What about that? What if it has nothing to do with prostate?
Excellent question. That's another myth. People say, oh, I drink a lot of water before bedtime, so I wake up multiple times. No, something is wrong with the bladder, and the bladder is talking to you. Your bladder as a man can expand and hold on the urine for 8 hours. So if you go to bed, even after drinking 2 gallons of water at 10 p.m., you should be able to sleep till 6 a.m. before your bladder says it's time to empty. However, if there is any issue with the bladder or the prostate is getting swollen, the prostate sits at the base of the bladder, and anatomically there is no gate. There is nothing that separates the two of them. So if the prostate is experiencing any difficulty, it pulls down on the bladder. Hence, the bladder wakes you up. You see some men complain every hour, I had to get up to pee. Not only that, getting up to pee should not come with any urgency. You should be able to say, oh, 2 minutes later I'll go. But when you feel the urge and you say, I have to go now, something is wrong. The prostate is calling our attention.
Wow. Okay, don't let me be too speechless about that. Okay, so how grave is this prostate issue? How grave is it?
Okay, so we can look at that from 2 angles, because we're in the part of the country, we're in the part of the world now where we don't have enough access and men don't go to the doctor. This is where we need our partners. This is where we need our sisters, our girlfriends, our wives to encourage men, because men just don't go. We carry the burden of all the society and we put ourselves last. That should be changed, because the sooner we see the men, the sooner we look at your PSA, we can actually diagnose. We can tell you what your risk factors are. We don't want to wait until you cannot sleep through the night. We don't want to wait until you are peeing on yourself. And we don't want to wait until you're unable to get your wife pregnant to say, hey, is your prostate one of the problems? Because what we are noticing now is we see increasing number of low sperm count in younger and younger men as a result of prostate problem. So we need to see them earlier. The sooner the better. So the women can encourage their men to just go for regular routine checkup. You don't even need to mention the prostate word. Just go to your doctor, and most doctors will be ready to say, look, you are at this age, I'm going to check your kidney, I'm going to check your lungs, I need to check your prostate as well.
Is it any doctor that can do this?
Any general practitioner is equipped to do that. It's just by blood work. You check for the prostate-specific antigen. Okay. If the PSA comes back and is out of range, what do I mean? Any normal male in good health, your PSA should be less than 4. 4.0 is the cutoff. If it's higher, it doesn't mean cancer, but the prostate is speaking to your doctor, and the good doctor knows what to follow up with.
Did I say more? Let me leave you with this quote from Len Dawson, which says, granted, prostate exams aren't the most enjoyable things in the world. But since they only last about 10 seconds, that's true, doctor?
Absolutely, yes.
It's well worth it. Just think of the possible consequences if you don't get it done. So what are you waiting for? Go get checked before it's too late. On that note, I draw the curtains on today's edition of Talking Health. Should you want to contact us for questions, comments, or coverage inquiries, please do not hesitate to call any of the numbers scrolling or send a mail to info@KongaTV.com. Remember to like, share, subscribe, and hit the notification button to keep updated on the latest in the world of health. Also, note that Konga Health is just a call away to attend to all your drug needs. Until I come your way again, think health matters. Think Talking Health with Bumi. Bye for now.